Our today's lecture is blood transfusion. Transfusiology is part of clinical medicine which deal with transfusion of blood and its components and products. In clinical practice, whole blood, its components and products may be used. In blood transfusion, we should consider blood grouping and rhesus factor. There are more than 30 antigen systems of blood, but most important of them is ABO antigen system and rhesus factor. There are 4 blood grouping. They are divided into 4 groups in K due to which agglutinogen and which agglutinin contains in erythrocytes and plasma. There are 2 types of agglutinogen, which called is A and B. They located in erythrocytes, and there is 2 types of agglutinin. These are alpha and beta agglutinin. They are located in plasma. In first group, erythrocyte of first blood group hasn't any agglutinogen, and plasma contain both of agglutinin, alpha and beta agglutinin. In second blood group, erythrocyte has agglutinogen A, and plasma has agglutinin beta. In third blood group, erythrocyte has agglutinogen B, and plasma has agglutinin alpha. And first blood group, erythrocyte has agglutinogen A and B, and plasma hasn't any agglutinin. Each group can be rhesus positive and rhesus negative. Rhesus antigen is antigen which located in erythrocyte. 85% in all of the people are rhesus positive persons which contain rhesus antigen, and 50% all of the people erythrocyte hasn't this antigen, and they are rhesus negative persons. There are several types of blood transfusion. These are direct blood transfusion, indirect blood transfusion, exchange blood transfusion, autologous blood transfusion. Most commonly, the main types of blood transfusion is indirect blood transfusion, when blood taken from donor and preserved and transfusion to recipient. The person which give blood to other persons is called as donor. The person which receive blood is called as recipient. The direct blood transfusion nowadays is rarely use exchange blood transfusion. This method involves a partial or full drainage of patient's blood and replacement its with equivalent volume. Exchange blood transfusion. There are four indications. There are some indications for exchange blood transfusion. These are poisoning, hemolytic disease of newborn, and other situations. Autologous blood transfusion. The procedure is blood transfusion of the own blood of patient may be performed to person. The blood which collected in a cavity of body, for example, abdominal and chest cavity, is taken and filtrated through 8 layers gauze, and added some conservant and transfusion to the same patient. There are some types of blood transfusion: intravenous blood transfusion, intraarterial blood transfusion, intra-aortal blood transfusion, and intraosseous blood transfusion. The main method of blood transfusion is intravenous blood transfusion. Commonly used cubital vein for puncture, and intraarterial blood transfusion is used usually in clinical days, in massive bleeding, and when intravenous blood transfusion ineffective. Intra-aortal blood transfusion is used in clinical days too. Intraosseous blood transfusion is used when other means of blood transfusion isn't possible. Widespread burns and intraosseous blood transfusion usually transfusion into sternum, iliac crest, and heel bone. There are several indications and contraindications for blood transfusion. Absolutely, indications for blood transfusion are acute blood loss, severe anemia, blood disease, major surgical operations, include those with heart-lung bypass, intoxications, severe burns, and other situations. Contraindications for blood transfusion are decompensated cardiac disease, cerebrovascular air embolism, severe kidneys and liver disease, general amyloidosis, bronchial asthma, septic endocarditis, hypersensitivity and other situations. There are some complications of blood transfusion. It's maybe allergic reactions, purine reaction, infectional complications, and other complications. There are the most complications of blood transfusion is hemotransfusion shock. Hemotransfusion shock and reactions of blood transfusion has 3 degrees. The mild degrees, moderate degrees, and severe degrees. In mild degrees, the systolic blood pressure higher than 8 millimeter, and the temperature of body increase 1 degree. Moderate degree, the systolic blood pressure 70 and 80, and blood temperature of body increase 1.5 and 2 degrees. The patient complains of muscle and bone pain, headache, and in severe degree, the systolic blood pressure lower than 60, 70, and body temperature increase more than 2 degrees, as well as 14 degrees. And the patient had pain of muscle and bone, headache, acute cyanosis of labia, and dyspnoea. The four treat complications of blood pressure mainly must stopping blood transfusion and transfusion the blood which same group and same rhesus factor, and used antihistamine substance, glucocorticosteroid, when the respiratory and cardiovascular center is decreased, we may use analgesics such as GanjaMed, coffee, and other substances. Thank you for attention.